Hello, I'm Dr. Claudine Aguilera, board certified internal medicine, and your host of The Doctor is In Breaking It Down. Welcome to episode 1. I'm so excited to talk to you guys about a very timely topic. Cold and flu season is here. We're right in the middle of it. And so I'd like to talk about, the differences between cold viruses, the influenza virus, a little bit on COVID, the treatment options we have. And a very common question that I get is, Doctor, why doesn't antibiotics work for these things? So let's dive right in. So colds are all over the place right now, right? These symptoms, they tend to come on a little gradually, and you might have headaches and stuffy nose and sore throats and coughs, but generally speaking, you're able to kind of go about your day. You don't feel great, but you're not in bed laid up, right? Whereas influenza is much more severe than that. We often say that you feel like you got hit by a truck, and that really is because you can go from feeling great in the morning to by the evening you're under your bed, blankets, shivering, not wanting to get out, feeling terrible with body aches, headaches, fevers. You can still have those sniffles, the sore throats, the coughs. The symptoms are much more severe. There's even people who I see sometimes get some stomach upset, so nausea and diarrhea and things like that. But it's a lot more severe. And one of the things I want to kind of share with you as a way to help you distinguish, how much more severe flu can be than a cold virus is to think back to your history lessons on something called the Great Influenza, otherwise known as the Spanish flu. And you may recall that this is when young soldiers, you're talking about late teens, early 20s, healthy young men who were out fighting our battles, were coming down with this horrible illness that was killing a lot of them. And so, yes, that was the Great Influenza. And so we can see that flu can actually be quite dangerous and much more severe. At the time, we didn't call it influenza. We didn't know what it was. But now, of course, we do. And we have ways to combat that. It is still quite dangerous to certain populations, and we do still have to be very careful with the very young, the immunocompromised, the chronically ill, and the elderly. As a practicing physician for many years in the hospital, I've definitely seen people die from influenza. So keep that in mind, that it's not really a virus to be toyed with. It's something to take serious. So if you do have influenza, we do recommend that you stay away from people, especially, the medically fragile. So that being said, there's a couple ways that we can combat flu. One of them is the flu vaccine. And you probably heard reports that the flu vaccine changes annually. And it really does, because the way viruses live is that they kind of go around replicating all the time. It's what they do. They infect a host and then they just replicate. So you can imagine, as you're replicating, there's going to be errors in that replication system, and then all of a sudden you've got a new virus. And just like in evolution, these new viruses can sometimes be better than the older ones they left behind. And then they start being the dominant ones that go through and infect other people. And so every year, the World Health Organization studies, which flu and influenza virus is going around. And they tailor the vaccines that are available to target the viruses that are going around more that year. And so we do recommend an annual update. So we don't want a flu vaccine that you had 3 years ago that's not going to benefit you today. The other thing we have that can help you with influenza, one of the popular brand name options is Tamiflu. You've probably heard of it. And this is what we call an antiviral. And the way this works is, remember we talked about a moment ago that viruses replicate. And what Tamiflu does is it stops the virus from replicating. So it doesn't really kill the virus that's sitting inside you, but it prevents it from replicating. And of course, then that virus is going to be, much fewer viruses in your body, and your body's going to be able to fight that. Much easier. And so it shortens the course and makes the symptoms less severe. So that's a great treatment option for you. We'd like, though, for you to get that treatment within a few days of getting sick for it to be effective. If you wait too long, it's not effective anymore. So how do we know if you have flu? Well, again, if you can get testing for it, that's great. So you can test that positive. You can get those over the counter. You can get them in the doctor's offices. And if you know that you have it, then definitely consider, if you qualify for something like Tamiflu, to talk to a doctor to get that going as soon as you can. Now, colds and flus can also be helped by a lot of other things, over the counter things that we can get, or even just, things that we don't have to go buy in the store, just things that, we can do. Biggest thing that we can do is get plenty of rest. Your body needs to have all its reserves to fight off, whatever virus it is that you have. Plenty of water as well. Your body is, majority water. And so we need that water to have our body function at its best. And again, we need it functioning at its best to be able to fight off these viruses. Vitamin C, vitamin D, and zinc is often something I also recommend, as there's a lot of studies that do show that that helps boost your immune system. So once again, vitamin D, vitamin C, and zinc. Okay. That being said, there's also over-the-counter medicines such as decongestants that can be very helpful. I often also recommend ibuprofen or Tylenol if you can tolerate those. That helps reduce your fevers, helps with the headaches, helps with those inflammatory symptoms like the body aches. So then you can feel a bit better right away. So yeah, helpful with that as well. Another big question that I get a lot is, doctor, why won't an antibiotic help me? I feel terrible. Give me that Z-Pack. I hear that all the time. Well, I'll tell you, the reason that antibiotics do not help in viruses is really based on how an antibiotic works. An antibiotic is designed specifically to attack a bacterial cell. And as bacterial cells, they have walls, they have organelles inside them. Viruses don't have those things. They literally don't have a cell wall. So a great example I'm going to give you right now is a lot of antibiotics target the bacterial cell wall, right? So they kill it by breaking down that cell wall. But a virus doesn't have a cell wall. It doesn't exist. So you can see that a medication designed to attack a cell wall isn't going to work on an organism that doesn't have a cell wall. So that's why it is not helpful in that scenario. Another big question I get is, of course, well, doctor, how do we know? How do we know if I have a bacteria or if I have a virus? So again, we can go back to that testing. If you're able to get the testing, that would be very helpful, right? If you test positive for influenza, you test positive for COVID, you test positive for RSV, those are viruses. And so we know, you probably don't have also a bacteria on top of that. So that's helpful. But say you're on the phone, say you're doing a telemedicine visit, you're off in the farmland, you can't, get to your doctor, there's no test available at the drugstore, we've seen this scenario play out. You just can't get the testing. There are guidelines, however, that we use to help distinguish, what we will do in those scenarios. And let's start just by talking about what the CDC guidelines are. So for these upper respiratory infections, these cold flu symptoms, sniffles, headaches, all of those things, the CDC actually has very distinct guidelines that says that we don't consider antibiotics. We do take a watch and wait approach to those symptoms for the first 7 to 10 days. And the reason they say that is that viruses are just much more common than bacterial infections. They hop from person to person quite easily. And so most of these are viral. And viruses run their course within about 5 days to 2 weeks, most of them 7 to 10 days. So the CDC's watch and wait approach really very much corresponds with that 7 to 10 day mark when most viruses are gone from your body. Your body has managed to take care of that. So what happens when we are over that time period? When we're in that 10-day mark and we're not feeling better, or sometimes even we're at that 7 to 10 day mark and we were feeling better, but then all of a sudden we're feeling worse again, like much worse. Those are scenarios when we say, you might have a bacterial infection. You might even have something that we call a post-viral secondary bacterial infection. So sometimes when our body is busy fighting this virus, there's only so much our body can do at one time. So we're more prone to infections that wouldn't normally bother us. And so sometimes we do get bacteria in there. And then we end up with that feeling better scenario. And then boom, we're feeling worse again. And that would be a scenario we would consider an antibiotic. Now, which antibiotic we choose very much depends on a lot of factors. One, what we think the most likely bacterial is based on the location of where your symptoms are. So are you having sinus symptoms? Are you having throat symptoms? Are you having more chest symptoms? Also we'll think about, what you're allergic to. Oftentimes people have an allergy. We clearly would stay away from a whole class of drugs in that scenario. And then the other thing too is sometimes people just have intolerances. Like, hey doc, I mean, I'm not allergic to amoxicillin, but gosh, does it give me bad diarrhea? And then we try to see if there's another option that might work better for you. So I hope that helps to explain a lot of cold, flu, bacterial infection, especially in this season. And thank you for joining us on episode 1 of The Doctor is In Breaking It Down. I hope to see you guys again soon. Bye.